Hello, welcome back to another video. In today's video, I have patient safety questions and answers for you. This is for the Mammography Registry Review. So if you could please like, share, and subscribe for more videos like this. I want to give a shout out. These are the people who passed their registry, I believe, for August of 2025. Shout out to these ladies. Also, shout out to Veronica. She was so sweet. She left me a donation after she passed her test. So I appreciate her for doing that. I appreciate How to Do Your Nails and Julia for coming back to the video or one of my videos letting me know that they passed their registry. So that was pretty helpful. And I thank you all. And also, congratulations. Also, these ladies passed their registry in July of 2025. I guess they just ran through my list of videos in my playlist because I do have a mammography registry review playlist for you to click on after you have clicked on my page, but I will also put it at the end of this video so you can just click right there. So congratulations and shout out to all of these ladies. All right, so for the Q&A, if you are new to my video and this is your first time seeing my videos, I like to read the questions, answer choices, and then I'll pause for a second and I'll give you the answer. So if you can, could you please comment down below? Let me know if you would like 20 questions, 30 questions, 50 questions in the Q&A videos because I'm not sure. So whenever I see your comments, it just helps me know how many questions to make. All right, so for question one, which of the following is the best way to confirm a patient's identity before starting the mammogram? A, ask the patient their name. B, ask the patient what type of exam are they having. C, verify the patient's doctor. D, verify the patient's name and date of birth. All right, the correct answer is D, verify the patient's name and date of birth. Always verify that you have the correct patient and date of birth by using a two patient identifier. You just calling the patient's first name or last name is not going to get it. It's not going to pretty much help. There was one day I had called a patient's last name and a lady got up. We went to the back, and I was just talking to her. Hey, my name is Marion. I'll be the one to do your mammogram. Could you verify your name and birthday? I always say your full name and birthday. She started telling me her name, and I'm looking at the paper because this is like 7 o'clock in the morning. She's my first patient. So I'm like, okay, maybe I'm still trying to wake up. My tea haven't kicked in yet. So I asked her, I said, could you repeat your name and birthday again? She repeated and it wasn't the right patient. So I had told her, I was like, I'm sorry, I called someone else. I have to put you back in the lobby and they'll call you back. And this just happened recently. This is still happening to this day where patients are still answering to the wrong name. This probably happened, I don't know, this week or last week. This is August of 2025. So I sent her back to the lobby. The correct patient I called got up and we were just talking in the back. She was like, oh, I wasn't sure. I thought it was two people with the same last name. So a lot of people aren't paying attention. They have those AirPods in their ear, they're on their phone, they're watching TV, they're reading a magazine. Sometimes people are hard to hear things or they're just ready to get their exam over, hoping that if they jump up, maybe you can just squeeze them in. You just never know. So you can always start the conversation by saying, for your safety, if a patient starts to become annoyed with you verifying their name and birthday again, because sometimes I do get where I call someone to the back and I ask them to tell me their name and birthday and they'll do this, because they don't realize if you answer to the wrong name, we're taking images under the wrong patient, or someone is taking images under your name, or you're the wrong patient, therefore somebody's getting the wrong results, even the wrong surgery. And I know I'm dragging this part out, but patient safety is just very important to me because a patient can get injured by you imaging the wrong patient or even pulling up the wrong name on the machine. And also, you can lose your license. So I love patient care and I love teaching about patient safety. All right, so let's get on to question 2. Sorry it took so long, but I'm just very passionate about patient safety. Question 2. Why is breast compression beneficial for patient safety? Choose the best answer. A. It decreases scatter radiation. B. Decrease patient radiation dose. C. Increase patient radiation dose. D. Reduce image quality. All right, the correct answer is B. Decrease patient radiation dose. Breast compression decreases the patient radiation dose. It reduces patient motion. Therefore, it improves the image quality. Question 3. A patient is complaining of pain during the mammogram procedure while their breasts are being compressed. What should you do as a technologist? A. Continue the breast compression because it is benefiting the patient. B. Run and take the image quickly and tell the patient it will be over in 20 seconds. C. Stop the breast compression. D. Tell the patient to reschedule with pain medication. All right, the correct answer is C. Stop the breast compression. So you want to stop the breast compression and document patient unable to tolerate much compression or the adequate amount of breast compression. Whenever you stop the breast compression, you're not lifting it up and keeping it at 0 pounds. You're lifting it up, checking with the patient, maybe even have to readjust the patient at this point because I'm sure they pulled out, pulled away, or removed their body from the breast detector. So I'm just reposition them. Start by compressing slowly. Keep checking with them. Keep touching the breast, making sure that they are okay, and then just document why you wasn't able to get much compression. Question 4. A patient arrives for a screening mammogram examination but is breastfeeding. How should you proceed with the mammogram? A. Cancel the screening mammogram and reschedule patient as a diagnostic mammogram. B. Have the patient reschedule when they are completely done with breastfeeding their child. C. Have the patient pump before the mammogram. D. Perform the exam without having the patient pump. All right, the correct answer is C. Have the patient pump before the mammogram. So you want to have the patient pump before the mammogram because with breastfeeding patient, it can make the breast tissue look denser. So therefore, the image quality will be slightly affected because the breast tissue is going to look more dense. So document that the patient is breastfeeding in their chart just so they can know, like the radiologist, you can still do the exam, but have the patient pump before the mammogram. If the patient does not have their breast pump or have not breastfed before the mammogram, check with the radiologist to see if they want you to have the patient reschedule. Because I've worked at least 3 different mammo clinics, different doctors. One radiologist told me I could do it, just document patient is breastfeeding. Another radiologist told me have the patient reschedule if they can't pump before the mammogram. So I always check with the radiologist. Just get comfortable with going up to them because they're not they're there to help you. They're busy, but if you send a patient away, what if they shouldn't have been sent away? And sometimes it take a long time to get on the screening mammogram schedule. So just always document, check with your radiologist. Even if you do cancel the patient, document why you reschedule them. Question 5. What is considered a safety risk factor when imaging a patient in a wheelchair? A. Patient being exposed to more radiation. B. Patient unable to position themselves correctly. C. Patient may fall if the wheelchair is not locked. D. The exam would take longer. All right, the correct answer is C. Patient may fall if the wheelchair is not locked. So always make sure that the wheelchair is locked before doing anything. Make sure the wheelchair is locked. All right, so if you are finding this video helpful, could you please like, share, and subscribe for more videos? Also, feel free to leave a comment if you have any questions. Question 6. What steps should be taken to avoid technical repeats and the patient from having to come back for additional repeat exposures? A. Apply at least 25 pounds of breast compression to prevent the patient from moving. B. Check prior images and current images before letting the patient go. C. Do not compress as much because the patient will say it is painful. D. Do not use AEC. All right, the correct answer is B. Check prior images and current images before letting the patient go. Always check your priors if the patient have them. Sometimes patients do not have them and you can't check them, but if they do, verify the images before the patient leaves, check the prior images. Sometimes you are able to get back more breast tissue than what the last tech got the previous years. I've done it before where I was able to get more. Sometimes if the patient has fallen or had a shoulder injury or some type of injury or back pain, sometimes you may not get as much. So you still have to document, you know, limited position, different notes like that to cover yourself. But also check with the radiologist to double check if you have any questions. Um, it's just good to check, especially if the patient lives like over an hour away or 30 minutes away or requires transportation. Also, especially if the patient is in like one of those motorized wheelchairs. Sometimes you can't get as much on those patients, so check with the radiologist. Hey, are these images good for this year before the patient leave? Different things like that. Question 7. A patient arrives for a mammogram and is pregnant. The patient has a lump and her doctor ordered a diagnostic mammogram with a breast ultrasound scan. What should you do? A. Adjust the KVP and mass so that the patient is receiving reduced radiation dose. B. Cancel the exam until the patient gives birth. C. Proceed with the exam and use a shield. D. D. Speak to the radiologist before starting the exam. Right. I'll give you just a few more seconds. All right. The correct answer is. Oh, and I forgot to say, if I'm going too fast, I should have said this earlier. Um, Pause the video, read the questions, or rewind it. All right, the correct answer is D. Speak to the radiologist before starting the exam. So, of course, a lot of the radiologists, they do want you to use your brain, especially if it's like simple things like patient is here for a screening mammogram and they find a lump. Instead of asking the radiologist if it's a new lump, you already know to like just reschedule them. But in this situation where a patient arrives and they're pregnant, I always reach out to the radiologist first. Sometimes the ordering physician may have ordered the exam wrong. Someone may have placed the exam in incorrectly. Also, the radiologist may want to start with breast ultrasound first, since this does not use any ionizing radiation, and then they'll go from there. I had a patient who came in one day, and the lady at the front desk roomed them because at the time our front desk ladies was helping room patients, and the lady let me know, hey, she's pregnant. Just wanted to give you a heads up. The patient didn't know they couldn't get it. They thought that we could just shield them and keep it going. But since they was there for a screening mammogram, the radiologist was like, they just need to reschedule once they have given birth. So there's just good information to know. I always say no question is a dumb question. Of course, ask as many questions as you can, because not only is this benefiting the patient, this benefiting you as a tech and avoiding you from losing your license if you do something the wrong way. So just let me know if you have any questions about this. Question 8. The main purpose of cleaning and disinfecting the mammography equipment is to A. Keep the machine from looking old and dirty. B. Promote infection control. C. Remove the makeup from the machine. D. Remove the sweat from the machine. All right, the correct answer is B. Promote infection control. So no judgment here. Could you put it in the comment box if you all take mammogram images with gloves on, or if you are not using gloves? Me personally, I use gloves because, like I was saying in my patient safety lesson video, I have eczema. So around the summer season and winter season, my skin, like, it gets irritated from either the cold or the heat. So sometimes I'm scratching a lot, or my skin is dry and I'm getting cuts. So I like to have gloves on. I wouldn't worry so much about offending anyone if you do put gloves on. If you feel like you may offend someone and they may think that you think they're, dirty or something, just let them know, oh, let me get my gloves on because my hands is going to be cold. You can say something like that if that makes you feel comfortable. But if you are just one of the ones who just like to get it done without gloves on, just make sure that you are washing your hands frequently, of course, after each patient and before each patient, if you're not using gloves, using your hand sanitizer. But whatever way works for you. I've had people who train me that wore gloves, and then I had one or two people that trained me that didn't wear gloves. So just let me know in the comment box, are you the ones that wear gloves or you don't wear gloves whenever you are taking the mammogram pictures? Question 9. The minimum number of patient identifiers that is required to promote patient safety is A, 1, B, 2, C, 3, D, 4. All right, the correct answer is B, 2. Always confirm both a patient's name and date of birth. Check the wristband in order as well, just to, make sure you're doing the right thing, you have the right patient. Let me know in the comment box if you did not know the answer to this question. Maybe your job doesn't preach about two patient identifiers. Some hospitals or imaging clinics may be strict, more strict or less strict than others. So let me know in the comment box if you knew this answer or not. It's question 9. Question 10. This is another situational question. A patient is feeling dizzy and believe that they may faint. What should you do? A. Call for another technologist to help. B. Finish the exam quickly. C. Stop the procedure and have the patient sit down. D. Put a chair behind the patient. All right, the correct answer is C. Stop the procedure and have the patient sit down. If Let me know in the comment box if anyone have a question about this. I've had to offer someone water, also document patient faints or get dizzy when having a mammogram done. Just let the technologist for the next year know what to expect. Also, they can do the mammogram in a chair, or if it just gives someone a heads up on what to expect. Someone was kind enough to leave a note for a patient that I had done from a previous year. They left a note like the year before, so I knew what to expect. I knew that the patient probably is going to faint or get dizzy, and she did feel dizzy, but she didn't faint or anything. Question 11. A patient safety concern for grids that are used in mammography is increased image blurring, B, increased radiation dose, C, reduction in breast compression capabilities, or D, reduced image quality. All right, the correct answer is B, increased radiation dose. So grids do improve image quality in mammography, but it does increase the overall patient dose as well. So, of course, we can't, like with X-ray, you can put the cassette in a grid. With mammo, we already know the grid is automatically built in. But if you look on your machine, I work on a Hologic. Comment down below if you know what mammo machine you work on. Is it Hologic? Is it GE? Things like that. On the Hologic machine I work on, you can click a button and it shows you grid in, grid out, no grid, things like that. Question 12. How should a mammography technologist proceed if a patient refuses breast compression? A. Cancel the exam. B. Continue the exam without breast compression. C. Document that patient refused breast compression. D. Slowly apply more breast compression. All right, the correct answer is C. Document that the patient refused breast compression. So always document, explain the importance of breast compression to the patient. Ask the radiologist or consult with the radiologist if the patient refuses. I've never had anyone refuse a mammogram because they don't want any compression on their breast. I've had patients refuse to have a 3D mammogram. They just wanted a 2D mammogram. But I've never had anyone say, I'm not doing this because I don't want my breast compressed. Um, well, I take that back. I've had one patient. Now that I'm thinking about it, I've had one patient who said she didn't want the exam done, and they wanted breast ultrasound. But typically, You're not going to get patients coming in just refusing breast compression. They may not want you to put, let's say, 15 pounds of breast compression on them. They may only want 10 or can only tolerate 8 pounds. But other than that one patient that I just remembered, I've never had anyone who just flat out said, I'm not doing this. So yeah, just document why you wasn't able to, especially when inspection time comes and they are reviewing the images and compression number. If you know you could have gotten at least 15, 18 pounds because you've seen this on their prior images from the year before and the year before and the year before, and there is no notes that the patient would not tolerate compression, then just document. I always document. Question 13, another situational question. A patient has limited mobility on the right side of their body. How should you help a patient up from a sitting position? A, assist the patient on their stronger side. B, assist the patient on their weaker side. C, have the patient pull themselves up. Or D, let the patient stand up fully by themselves. All right, the correct answer is B, assist the patient on their weaker side. Always stand on the patient's weaker side when helping them up or assisting them. All right, so if you could please leave a comment for me if you are enjoying these practice test questions and answer videos. If this is your very first time or second time watching my video, I do have a playlist where I have review lessons. I have practice test questions and answers for anatomy, patient care, now patient safety, physics. So just let me know in the comment box which test area you think you'll need the most help on, patient care, physics, anatomy. It just helps me know what videos I need to make just to help you all pass your registry. All right, question 13. How many seconds should you wash your hands for? A, 10 seconds. B, 15 seconds. C, 20 seconds. D, 25 seconds. All right, the correct answer is C, 20 seconds. So I know this is, may not for all, but maybe for some, this can be a tricky question. That's why I wanted to throw it in because we think, oh, hand washing, that's an easy question. But you'll be surprised how many people forget how many seconds you're supposed to wash your hands for, which is 20 seconds. Let me know in the comment box if you knew this answer or not. Question 13, did you know the answer? If you knew the answer, say, I knew the answer for question 13. Or if you didn't know, or if you knew, just say 20 seconds. Say something for me to know that you made it this far. You can say 20 seconds. Question 14. Which of the following helps to minimize radiation dose? A, increase KVP. B, increase mass. C, proper breathing instructions. Or D, using AEC. All right, the correct answer is C, proper breathing instructions. So, proper breathing instructions is the best way to minimize radiation dose to patients in mammography because it does reduce those repeated exposures. Even though using AEC is helpful, what if you haven't given the patient the correct breathing instructions? So therefore, you're having to, even if AEC is adjusting your technical factors the way it should, you're still giving the patient more radiation dose because you keep having to repeat and repeat and repeat due to patient motion. So I always give the proper breathing instructions to avoid having to re-expose the patients to more radiation dose. Question 15. Prior mammogram images must be reviewed before the mammogram exam to A. Adjust technical exposure factors to the correct exposure factors. B. See how much breast tissue the technologist was able to get on the last mammogram image. C. See which radiologist and mammography technologist performed the exam and read the exam. D. Use the same technical exposure factors as the last technologist did. All right, the correct answer is B. See how much breast tissue the technologist was able to get on the last mammogram image. Also, the patient may have breast implants this year. Last year, they may not have had breast implants, but they probably have gotten them 3 months after that last mammogram or 6 months after that last mammogram. So that's why I always check with patients. Um, you just never know. They may decide to get breast implants at age 60 or 42. You just never know. Question 16. The proper way to discard a needle is to A. Place in a sharps container. B. Recap the needle. C. Throw it in the trash can. D. Wrap it in a paper towel and glove. All right, the correct answer is A. Place it in a sharps container. Never recap needles. The reason why you shouldn't is because you can accidentally stick yourself. And once you do that, you're opening up the chances of getting hepatitis, HIV. Um, it just an injury. You just never know. So you never supposed to put when I mean by recapping, you're putting the needle back on the actual cap that it came from. I always place the needles in the red sharps container. You may have to discard needles whenever you are assisting the radiologist with biopsy procedures. I know in mammo, you're really not gonna use a needle unless it's with biopsy procedures or getting rid of it. Also, I know we don't really use any needles in X-ray, but let me know in the comment box what other modalities do you work in? Do you work in CT, MRI? I work in other modalities and I have to start IVs and, get rid of my needles and things like that. But just let me know in the comment box if you only work in X-ray or you work in other modalities where you use needles. Question 17. The acronym RACE is used for A patient fainted, B, a fire, C, a hurricane, D, a tornado. All right, the correct answer is B, a fire. And I had this in my patient safety lesson video. If you want to check that out, it will be in the playlist. Also, I'll try to remember just to link it at the end of this video so you can go back and check on it. But R stands for rescue, A stands for alarm, C stands for contain the fire, E extinguish. So, or evacuate, because E can stand for extinguisher or evacuate. Question 18. Which of the following is not considered a patient safety concern? A. Infection control. B. Having the correct patient. C. Performing an XCCL image or additional imaging. D. Proper breast compression. All right, the correct answer is C, performing an XCCL image or additional imaging. If this question confused you, just rewind it and just read it again. But additional imaging is sometimes required and needed in mammography. Um, if you are missing the IMF, or if you're having skin folds, or if you did not cover the dense tissue that you did not get on the CC image, or even if you did not get a good nipple and profile on the CC or MLO image, then you have to do a nipple and profile picture. So this is not a patient's safety concern because this is needed. Question 19. A patient arrives for a screening mammogram but has a new breast lump that they are not concerned about. What should you do? A. Have the patient rescheduled as a screening mammogram when the lump goes down. B. Perform the screening mammogram. C. Perform the screening mammogram and then call the doctor's office for a breast ultrasound scan. D. Reschedule the mammogram to a diagnostic mammogram. All right, the correct answer is D. Reschedule the mammogram to a diagnostic mammogram. Regardless of how many times you have a patient or patients tell you, my doctor said I can do it under this order. No offense, but the doctor does not know how radiology works. They don't know the law and the regulation behind if a patient has a breast lump, a known breast lump that is new, or is getting bigger, then they have to be a diagnostic mammogram. Sometimes doctors do not know that the screening mammogram is not going to catch everything. It may show it, but it's not going to look further into detail like a diagnostic mammogram will, with your spot images, with your mag views, or even the breast ultrasound. So as a new technologist, just get in the habit of just, you know, worrying about, okay, this can't be done. They have to reschedule. Don't, of course, you're going to feel bad because this is going to cause an inconvenience, but it is also needed. And it's the regulation, the law for how you do things in mammo. Question 20. Which shielding device is sometimes requested by patients in mammography for patient safety? A. Abdomen shield. B. Breast shield. C. Face shield. D. Thyroid shield. All right, the correct answer is D. Thyroid shield. So I know there are changes with shielding patients now, but the place I work at doing mammogram, they still have like thyroid shields around. They still have like lead apron waist shields. So there are times when patients may request a thyroid shield. It may not be every day, but there are like occasionally where they may. So always document when a shielding device was given, just so in case someone say she didn't shield me, you have it in your notes, like right there, that the thyroid shield was provided per patient's request. So always document, even if sometimes when I see a patient come in and they have a bruise on their wrist or a bruise on their arm, I am documenting while I position a patient for MLO view. I noticed the patient had or while I position a patient for a CC view, I know a patient had a bruise on their right wrist. Um, Patient stayed, this happened 1 week ago. They fell, they tripped over their dog. Um, just document, because what if someone come back like a week later and was like, the tech was being rough with me. They um they bruised my arm or they bruised my breast, so even if there is a small bruise on the breast, I document patient notice a bruise 2 days ago. grandchildren was jumping on them while playing. Um, Dog jumped on them, cat scratched them, anything. I document everything. All right, so if you do not mind, could you please leave a comment, let me know where you're watching from. There's just something cool that I like to do, something fun. You can say I'm watching from, you can say your state, your country. I have a lot of people watching from California. I have people watching from Atlanta, Georgia, Houston, Arizona, Florida, Maryland, Kentucky. This also lets technologists know, oh, they have plenty of jobs in Montana. I want to move there, or New York. So that's why I like to do this as well. Also, I have more people watching from Ohio, Saudi Arabia. So that's the first place that's somewhere else, like another country, that I've gotten a comment from. I have New Jersey, Maryland, Arizona, Michigan, Northern California, Miami, Florida. I think I said Ohio, Memphis, Tennessee watching. So just let me know where you're watching from. And then I also just like to see how many techs are still trying to join mammography. All right, so I have a question for you. Please leave a comment down in the comment box for me. Did you find these questions and answers helpful to you? You can say yes, I found them helpful, whatever you want to tell me. What other questions or videos would you like to see from me? Would you like to see more of these videos? Would you like to see a full review lesson on something? Up until this point, from when everyone else took their test and posted it to me, I didn't have a lot of these videos made, so they passed their registry with like bare minimum of videos that I had. The more comments and likes I see on the video, the more videos that I will make, because it lets me see, hey, people are enjoying the videos, they're finding it helpful, they're requesting new videos, they want to see an updated video. So the more likes and comments I see and read from you all, it just motivates me to make more of these videos. Like I've said, which you will probably hear in my older mammo videos that I have made, it does get I love making these videos, but it does get time consuming. So just me seeing a thumbs up, a comment, I really appreciate that, and it just helps me to keep making more videos. Also, comment down below your test date or how long you're going to prepare for your registry exam. Check out how to get organized and prepare for your mammography exam, because I give tips and tricks on how long you should study for, how you should pass on the first try. All of that will be in my playlist that you can click at the end of the video. All right, so if you found this video to be helpful, and if you learned something from this video that you did not know before, could you please give the video a thumbs up, comment down below. You can just put a simple comment, thank you for your video, kind of like how Amanda did, or let me know I passed my registry. Thank you for your time, like Arja Leah did. Or I appreciate you for making this video. Great video. Anything, just if you don't mind, could you please leave a comment? Also hit the subscribe button so you do not miss any new videos from me. You can also see all of my old videos in one place, and not forget my name or anything like that. So anyway, thank you all for watching. If you stayed this long to the end of the video, um can you comment something like great job, or I watched all the way to the end, or something like that? Keep posting. So just let me know. Give me like a keyword that you made it this far. All right. Keyword, you can put patient safety if you made it this far. So thank you all for watching. Good luck on your registry, and comment down below if you want more videos. Bye.